NHS. For 6 months, junior doctors have been in a bitter dispute with the government over the terms of their new employment contract. But a fortnight ago, a truce brought hope a resolution might be possible.
Save our NHS!
And after 10 days of intense talks mediated by the conciliation service ACAS, this afternoon came this announcement.
An ACAS statement setting out the terms of an agreement has been presented to the government and NHS employers and to the BMA. And that statement has now been agreed by all the parties as resolving the current dispute, subject to securing the support of BMA junior doctor members in a referendum.
Not safe, not fair. Jeremy doesn't care.
There have been 5 strikes since January, affecting a total of 8 days. The last walkout, a complete withdrawal of labour, including emergency care. More than 37,000 patients have had their operations postponed, along with more than 100,000 outpatient appointments. Any deal brokered at the impersonal offices of ACAS will need to have forged compromises where doctors and ministers were poles apart. Top of that list, pay on Saturdays. The government has insisted on limiting the pay premium that Saturday shifts attract in order to further its ambition for a more 7-day NHS. But the doctors have been fearful that that would open the door to them being spread ever more thinly, perhaps dangerously thinly, across the week. Junior doctor Matteo De Martino says he'll be content as long as patient safety is not put at risk.
Of course, we would rather not have to ever strike again, because ultimately what we want to be doing on those strike days is in the hospital, working with our patients, for our patients, and for the future of the NHS, not stood out on a picket line trying to disrupt this.
The NHS should be on.
But this does not mean the dispute is over. First, the British Medical Association will need to seek the approval of its junior doctor members across England. It's the tens of thousands of doctors who've manned the picket lines with such determination who'll have to decide if it's a workable deal.